Lifestyle choices. What sort of choice do we make in life that we have to think about is smoking. Is smoking going to be in the USMLE? Absolutely. Because when we think of smoking, it's a major cause of premature preventable death in the United States. In fact, it is number one. What's number two? Morbid obesity. The percentage of the U.S. population that smokes is roughly about 25%, but because of state laws like California, the number of people who are smoking are less than 14% today. Males tend to be smokers more than females. However, what age that females tend to smoke the highest are teenage years. Why? Because women use cigarette smoke as an appetite suppressant because they have body image issues at this young, tender age compared to males. And they also use it as a way of being adult-like. Actually, it's risk-taking adult behavior rather than being truly adults. And the type of smoke is mainstream smoke. You think of smoke that's inhaled by the smoker versus the side stream smoke. It's either the passive smoker that you inhale as a bystander, either from the smoker who's exhaling it or the lit cigarette, marijuana cigarette, or whatever is being burnt. So how many chemicals are there in cigarette smoke? Roughly over 4,000 components. There's well over 40 known carcinogens, up to 60 have been described. And let's go through just the first 5 that we can find just to illustrate how bad smoking is. 1, it produces carbon monoxide because of incomplete combustion of organic material, so obviously going to bind to hemoglobin. These patients are going to have low tolerance to exercise. So they're going to be in a denial state. They think, well, I smoke during the day and I go to the gym at night. It's not going to cancel it out. Second, it also produces arsenic, the very thing we're worried about, binding to sulfhydryl groups and causing damage to various organs, and it'll inhibit heme synthesis and so further decrease oxygen carry capacity. Formaldehyde that we use to fix tissues. When we think of the bodies we use to do gross anatomy or we preserve tissues, so you produce formaldehyde and obviously it's going to be toxic to the cells, cause damage. It also produces hydrogen cyanide. It'll disrupt oxidative phosphorylation through cytochrome C oxidase and further diminishing the ability to make enough energy for cells to maintain their cellular processes. And then finally, we think of the addictive nature of smoking. We think of nicotine, but nicotine, when it's during combustion while you're smoking, it will lead to carcinogens and then add to the number of cancers besides the other carcinogens like benzene and benzopyrene. So when we think of the cancers that are associated with smoking, the way you think of it is wherever smoke enters the body, where it travels and exits, produces cancer. So what are some common places to illustrate this fundamental principle? We always think of the lung. We inhale the smoke. It goes down the lung because 85% of all lung cancers in the world, as well as the United States, is due to cigarette smoking. And you'll see how people say, I don't inhale as a patient. Well, that's not good either, because essentially the carcinogens are in your saliva. They sit in your oral cavity. Then you swallow it. It'll coat your larynx or above your larynx, go down your esophagus, allowing esophageal cancer. And what will expedite this process is when you see people in bars or people at gatherings where they have alcoholic beverages, that will facilitate the carcinogens getting into the cells, promoting mutations. Why is that the case? Because remember from organic chemistry that alcohol is a solvent and it increases the fluidity of the plasma membrane around cells and will facilitate these carcinogens in entering the cells. And who's a famous person in history who, when you watch the movies, who smoked and drank and died of esophageal cancer was Humphrey Bogart, whether it's the Casablanca or the Maltese Falcon. Now you're asking, well, how does it get to the cervix? It's so far away from the lungs in females. Well, an important thing you have to realize is this is either if you're a female who's actively smoking or a female that's exposed to passive smoke, is that the carcinogens will travel in the blood and be excreted into the vagina, from the vagina, and now will coat the cervix and increase the rate of cervical cancer. And then if they have human papillomavirus on top of it as a co-conspirator or co-carcinogen, will accelerate it as well. It likes to cause pancreatic cancer. It can obviously be excreted. It's going to go to the renal tubulars where you get absorption, causing renal cell carcinoma, go to the ureter, give you ureteral cancer, sit in your bladder while you're smoking and drinking, leading to bladder cancer. And because smoke has benzene, it can lead to leukemia. It tends to be what type of leukemia? Acute myelogenous leukemia versus ALL. And those are the important cancers that we have to think about when we associate with smoking. Another important consequence of smoking is illustrated is the cardiovascular system. What poor cell has to live in the cesspool of a smoker in the intravascular space is the poor endothelial cell. So when you damage that poor endothelial cell, you're going to accelerate what disease? Atherosclerosis, hardening of the arteries. And that'll obviously lead to vessels that are affected by atherosclerosis, like coronary artery disease, leading to myocardial infarction or ischemic heart disease. It can lead to the induction of vasospasm of the coronary vessel, leading to acute ischemic damage or lethal arrhythmia. It'll obviously accelerate atherosclerosis in the peripheral vessels, especially in the lower extremities, leading to gangrenous toes and feet. And then it can structurally weaken the walls of the aorta, leading to aneurysms or dissections. And then we have a smoking-related vasculitis called Buerger's disease that you get now lose your digits, the tips of your toes, your fingers, your ears because of the gangrenous process of necrosis because of another name for Buerger's disease is what is called thromboangiitis obliterans, where the smoke damages endothelial cells, releases tissue factors, stimulate thrombus formation, occlude the vessel wall, the lumen, therefore leading to infarction and gangrene. Remember, when you remove the U in Buerger, it means Buerger's disease, not burger. This is a French, and when you think of Buerger's disease, it's what type of glomerulonephritis is IgA nephropathy. When we get to the renal section, you'll revisit this. Stroke, obviously the most common vascular disease in the CNS is going to be atherosclerosis, where you can have a thrombus formation or in the cerebral vessels leading to occlusion and infarction, or an embolic event from a carotid artery that has atherosclerosis and now causes a stroke or infarct. Another consequence, another organ system that can be affected due to smoking is the respiratory tract. Not only lung cancer, but you got to think of the damage it's doing to the airways and alveolar sacs. Obviously, if you're a chronic smoker, you have to worry about chronic bronchitis because remember the definition of chronic bronchitis is a clinical definition. It's defined as a chronic productive cough for 3 consecutive months for 2 years or more, because remember, a common sign or symptom of airway disease is production of mucus, leading to a productive cough, like not only chronic bronchitis, asthma, and bronchiectasis. Another important disease that it can elicit that when you go over the respiratory tract is that self-digestion of the lungs, because remember, cigarette smoke will stimulate the release of both the neutrophils in our body as well as macrophages to release elastase. So your self-digestion. Do you feel it when you're digesting your lungs while you smoke? No. But you will feel the consequences of this obstructive airway disease when you try to walk up a flight of stairs or a block. And then in not only children but adults, it can lead to asthma, reactive airway disease, because of the components that can sensitize the individuals to the cigarette smoke. Obviously, it can damage the respiratory tract and decrease the mucociliary clearance, increasing the risk for pulmonary infections like pneumonia. What is the effect on women? You have to remember that the chemicals in cigarette smoke is anti-estrogenic. So obviously, it can lead to early menopause. It can also lead to the effect on the bone, leading to postmenopausal osteoporosis. And it also has an effect on pregnant women. And what do we see is it can lead to increased spontaneous abortion and stillbirths. Remember, all these chemicals are now going to cross the placenta and now get access to the fetus and cause abnormalities like stillbirths or cause the induction of pregnancy at the inappropriate time, leading to spontaneous abortions. Obviously, you have carbon monoxide and all these toxins. What's going to happen to the ability to go through the process of embryogenesis? It'll be severely curtailed, and you can lead to intrauterine growth retardation. The effect on children who live with the smoker, it can increase the risk for sudden infant death syndrome, SIDS, or it can lead to damage to the ciliated pseudostratified clump epithelium of the upper and lower respiratory tract, so leading to otitis media, as well as pharyngitis. And then obviously, as mentioned earlier, it can get into the lungs and increase the risk for asthma. Let's talk about drinking in the United States and other parts of the world. A little ethyl alcohol is called for. And when we talk about ethyl alcohol, there are two types of intoxications, acute and chronic. So when you think of acute, what age, what sex, what time of the year, and where in the United States is this a real problem? What sex? You think of males. Males have a propensity in society to overindulge in alcohol. What age? Usually between the ages of 18 and 22. Where in the United States? Universities and colleges. What time of the year? Typically in the fall and spring. Why the fall? Because it's their first time away, especially freshmen. They have a propensity to say, now I'm an adult, I can handle alcohol, so they drink large quantities in a short period of time. Or you're trying to get into a frat or fraternity, and they're asking you to drink a gallon of vodka in an hour. The only problem is, you know it's a CNS depressant, you'll stop breathing, and you'll never wake up. And so this is something that one has to always be concerned about in this population. But women are catching up. They also, too, like to drink alcohol at these various sites. And women have to be more careful than men because they are not good metabolizers of alcohol compared to males. And so they have a greater propensity of acute intoxication compared to males. So it's a CNS depressant. It can lead to coma, respiratory arrest. And then chronic alcoholism, we have to think of changes to what organ metabolizes of alcohol. As other sites is the liver, so it can lead to fatty change, which is still reversible. It can lead to acute alcoholic hepatitis. And then eventually, if you're persistent with drinking, it can lead to micronodular cirrhosis. It can also lead to macronodular if you have some people only drink when they get paid every 2 weeks, so they go through binge drinking. So depending upon the pattern of injury, it can have different consequences, but the end result is cirrhosis, because what's the most common cause of cirrhosis in the United States is alcoholism. When we talk about the other components of GI tract, its effect on alcohol is very toxic to the lining of the stomach and lead to acute gastritis, and because of the alcohol, it can produce or induce in individuals violent vomiting episodes. And in doing so, you can get linear lacerations at the GE junction, and that's called clinically Mallory-Weiss syndrome, and you can bleed to death because of the lacerations. Another important organ that's part of the GI tract is an accessory organ, is the pancreas. One of the most common causes of acute and chronic pancreatitis is chronic alcoholism. And then remember that alcoholic beverages do not have vitamins. They're not nutritionally fortified, except what alcoholic beverage has some vitamins because of the fermentation process is beer. But they do not contain folate or vitamin B12, which can lead to megaloblastic anemia. And then obviously women who are pregnant, you have to worry about fetal alcohol syndrome. It's one of the most common problems in the newborn is women have now exposed their fetus to alcohol. And then another thing you have to realize when we talked about PMNs and how it affects the Krebs cycle as well as affecting oxidative phosphorylation, it can lead to what cardiomyopathy is dilated cardiomyopathy. When you think of dilated cardiomyopathy, you're destroying the contractility of the heart. Alcohol is one cause, but remember other causes like, for example, thiamine deficiency, cocaine, chronic cocaine use, as well as pregnancy where you have increased blood volume. And if you destroy the contractility, what part of the cardiac cycle is being affected is systolic function. So contractility is the common denominator when you think of dilated cardiomyopathy. Oh, another one you should always remember, what chemotherapeutic agent is associated with cardiac toxicity is deoxyribicin. which is used in chemotherapy. It can also lead to dilated cardiomyopathy, so it's contractility. I remember having a patient who was an alcoholic at the age of 35, where when you did a chest x-ray, his heart touched the left chest wall as well as the right chest wall because he had started drinking as a teenager and had severe dilated cardiomyopathy. And what's the complications of dilated cardiomyopathy is arrhythmias and congestive heart failure. So they often require a pacemaker or defibrillator, one or the other. And then because alcoholic beverages are not vitamin fortified, you have to worry about Wernicke-Korsakoff syndrome because of thiamine deficiency. And remember, in this case, or what parts of the brain you're destroying, the mammary bodies, as well as the vermis of the cerebellum. That's why you'll see patients walking down the street and they look like they're drunk. They basically have developed ataxia because of the chronic damage to the cerebellum. And they also get psychosis and nystagmus, abnormal eye movement, as you recall. And so at one time they were thinking about putting vitamins in alcoholic beverages, but that has never come to fruition. So the moral of the story is alcohol as a source of nutrition is very poor. And then another consequence of chronic alcoholism is neoplasia or cancers. So when you think of alcohol, it's not a carcinogen. It can facilitate carcinogens or facilitate a process in the organ that will lead to carcinogenesis. For example, when we talk about a hepatocellular carcinoma, it's not the alcohol itself that's leading to the hepatocellular carcinoma, it's rather that the cirrhosis. Remember, the most common cause of cirrhosis in the United States is alcohol. And because you have regenerating nodules, these regenerating nodules will have a higher rate of mutational events taking place that can give rise to cancer. And then, since alcohol as a solvent, can facilitate the entry of carcinogens, chemical carcinogens into cells like the oropharynx, the larynx, and esophagus, you have a greater propensity for these cancers. So alcohol has an increased propensity for increasing the likelihood of cancers by allowing various processes to increase the rate of mutations and allow a neoplastic process to evolve. Another type of alcohol that can lead to toxicity is methyl alcohol or methanol or wood alcohol. It can be metabolized through the same enzymes like ethyl alcohol, like alcohol dehydrogenase, to formaldehyde and formic acid, leading to a metabolic acidosis. Where do you find methyl alcohol? You find it present in solvents, paint remover, and other household chemicals, but it also is found in antifreeze because some people try to commit suicide by drinking antifreeze. And what's the consequence of this, obviously, is that these products that are being produced by the ingestion of methyl alcohol is it can damage the retina, leading to blindness, and it can obviously lead to death. And what they've asked in USMLE is how do you treat it, is to give the patient IV ethyl alcohol because, as you recall, the absorption of alcohol is variable in the GI tract, and especially if you have food in the GI tract, it can cut down the absorption of alcohol by 50%. That's why they always tell you if you go to a gathering, a party, or festivity where alcohol is being served and you don't want to get drunk or have the effects of alcohol, is to eat before you go or eat while you drink because it'll cut down the absorption again of alcohol by 50%.